Cape Town is one of the most beautiful cities in the world, but many communities are impoverished, riddled with crime and gang violence. Toxic stress filters into the oversubscribed maternity clinics in these areas.
The Compassionate Birth Project and Manor, through Coraline's Innovation Lab, have developed a collaborative project called the Dignity Birth Campaign.
This one particular night, though we had a student midwife, we had 19 deliverers.
So as that baby was coming out, put the baby on the tummy, another admission came in as well, with the baby already, the head out already in the panty.
The Compassionate Birth Project was established almost 10 years ago to bring love, respect and the Sacred Heart back into birth spaces where midwives can be valued, supported and respected.
The Dignity Birth Campaign is offering international workshops and webinars to midwives from all walks of life. Their aim is to de-stress midwives, build self-confidence and to turn trauma into action. Okay, so we're going to start with a relaxation, which is really helpful in the midst of all the hectic stress in maternity. Every now and again, just to be able to breathe deeply, come back into your centers again. And so you can either keep your eyes open, just gazing downwards, or closed as you wish. And then take a couple of deep breaths in, all the way down into your bellies. And as you breathe out, relax. And feel your body relaxing on the out breath. And then when you're ready, you can open your eyes.
Just going to do a round now on how you feel some of the things that the Compassionate Birth Project bring would help in the workplace as a midwife.
From the workshop, it sort of helped me, skilled me, because I wouldn't judge a person as I don't want also to be prejudged.
Can you also tell me something about how it helps you yourself? So not just for the benefits for the patient, I'm really interested in how it can help you deal with your own stress as well. So how does being listened to help you with your stress?
You feel like that you can work better. There's a better environment with you, amongst colleagues, and also with patients as well. So I feel like if I know that I'm being listened to, I feel much more appreciated. So it brings out a confidence in me as well.
Midwives in South Africa carry the enormous responsibility of incredibly high infant and maternal mortality rates, the pain of women suffering in unsupported labours, and case overload.
What are some of the stresses that you experience either in your home environment or in the work at the MOU?
Difficult patients really, and drug substance abuse really takes. And especially in the community where the facility is as well, there's a lot of substance abuse. 40% of the patients that we have
Are abusing
substances. My one colleague is so frightened of heroin abusers, tend to get very, very, very aggressive. And also the pain thresholds are very low. I think that's where the aggressiveness comes from, because they don't have, if I can say, coping mechanisms to deal with the pain, because they need to get that next, if I can say, hit. Most of them will use before they come in, because they know it will last them in early labor, but as soon as that active labor starts, the heat goes down and then the pain comes up.
The Dignity Birth Campaign aims to counter the systemic disempowerment of midwives who are often unsafe, undervalued and disrespected.
I was just listening to you now, Pinky, and it feels like when we feel valued, we have more ability to have a larger space for other people.
If I'm not listening, then she's already losing confidence, and I make my own assumptions in whatever she's gonna say. But from there, it started with me, the change, and then it spread to all other staff members. Like I say, even with my own kids, it helped me because now I'll listen to what my daughter is saying, my son is saying, then it sort of helped.
Yeah. So we had a group from France come out and make a little movie clip on the Compassionate Birth Project, some of the stuff that we're doing. So actually I'd really like to show that to you guys now.
I'm 18 and I was pregnant at the age of 16 in grade 10. I had a really short pregnancy because I only found out when I was like 5 months. I went to False Bay Hospital, which was a nightmare because I felt with the nurses that they didn't accept that I'm so young and pregnant, so everything they did was to kind of like shove it in my face that first of all, you're young and you did this to yourself, so you have to suffer. I didn't feel welcomed or it wasn't nice. I felt like I did something wrong, which I understand, like, okay, being pregnant at a young age is it's not ideal, but it happened and I felt judged.
Mothers expect support and compassion from medical personnel. Trust and respect are the keys to a successful delivery, but in South Africa, verbal and physical abuse undermines this relationship. The reason for this is poor working conditions. Clinics are understaffed and midwives are often underpaid and overworked and cannot provide patients with dignified and respectful treatment. The traumatised mothers then hesitate to go back to the hospital, which jeopardises their health and the health of their babies. Currently, a project called Compassionate Birth Project restores compassion to the centre of the relationship between the mother and the midwife. During their training, doctors and midwives are made more aware of the importance of high quality and personalised support for pregnant women. This programme makes listening and empathy the basis of the relationship between midwives with their patients. Medical personnel are also assisted and supported in enhancing their self-esteem and reducing the stress of their working environment. As a result, the future mothers receive better treatment. The results can already be seen in several hospitals in South Africa.
I welcome any project in where we can assist women. Remember, it's important, women's health. Remember, a woman is a cornerstone, I feel, a rock in any family. So we need to look after the mother, her mental health, so she can look after her family. The woman is at the most vulnerable. She needs assistance, and we need to be there to guide her and be supportive towards the patient during that time.
The reason that it's so important to create a more compassionate environment is not only because we want the babies to be more emotionally stable and so on after, but actually because the outcomes in terms of maternal child health are affected quite significantly.
If more programs like that put the word out there, if things like that could go on, like a lot of them, and maybe it could change. And if that program could involve like people from like communities like this community, I mean, to put the word out there, maybe it could change actually.